Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by your friends at Headspace. We would like to remind you that the chat feature is available, so feel free to send in your questions for the panel throughout the discussion. Our speakers would love to hear from you. And with that, I will turn it over to our moderator, Jonathan Barry.
Hello to our streaming participants, and welcome to our live panel discussion on the hidden cost of poor employee mental health. Today, we're going to be discussing the need to support your employees' mental health. Very, very important. I'm pleased to be joined by two great individuals. First is Lakeisha Liddell from JPS Health Network, and also Lisa Gonzer from St. Luke's Health System. I'm Jonathan Barry, and I'm privileged to lead the enterprise sales team here at Headspace. And before we get started, just wanted to go over a few housekeeping items. We do have time set aside for Q&A, so please send in your questions anytime throughout the chat, and we will get to as many questions as we can fit in at the end of this presentation. If we don't get to your question, someone will follow up with you after the webinar. It is very important to us. We'll also send a recording of the webinar in about 72 hours from today. And please keep in mind, as is everything should be, this is a safe space for both panel participants and for attendees. So please approach your questions with respect and kindness. We really appreciate that. So with this, I think, sort of kicking things off, I'd love for each of our panelists to introduce themselves and tell us a bit about your organizations. You two great organizations represented. I think, Lisa, I'll throw it to you first.
There we go. Thanks. Hi. I have the privilege of working for St. Luke's Health System in Idaho. We are a large system that employ almost 17,000 employees across southern Idaho. We have 9 main hospitals and then over 300 ambulatory clinics where we serve southern Idaho and eastern Oregon patients in a wide variety of services and programs. So I've been with the organization for 23 years and have seen it grown from a couple locations to now a statewide system. So I'm very happy to be here and to have this important conversation.
Thank you, Lisa. And Lakeisha, we'd love to know more about you and JPS.
Thank you guys for having me to be part of the panel today. I work with JPS Health Hospital System. We are a state hospital. We have over 7,200 employees, and we serve the community as well. We have a number of clinics. We have a very large behavior offering at the hospital. We serve a lot of our individuals that may need assistance in getting medical care, but mostly my role as a wellness program manager is serving wellness for our employees because they are the ones who take care of our patients. A little bit about myself. I am a certified wellness practitioner. I'm a certified wellness program coordinator. I have a master's in public health and an undergrad in exercise physiology. And I'm going to show my age a little bit here. I've been in corporate health and wellness for over 25 plus years, but I enjoy every moment of it because this field always grows and always give us something more to know about. So thank you for having me be part of today's panel.
Thank you, Lakeisha, and 25 wonderful years, I'm sure. I told Lakeisha and Lisa, I actually cut my teeth working for a regional health system in North Carolina after college. So I can definitely empathize with what goes on with the vital frontline workers and healthcare workers. And we're going to have a good discussion today. So thank you both. So with that, what benefits, I think maybe Lakeisha, I'll start with you. What benefits do you think are most valued by your employees? And what benefits are you providing that support their mental health?
So the benefits we provide our employees at JPS definitely is around mental health services, right? We are a state hospital. I mentioned in my intro, we do a lot of behavior type services. So you are going to deal with families and different individuals that may have issues that can affect our employees. So we have learned over time, the mental health services is something we like to bring into our offerings. So we do that through coaching, the coaching for family with not just the adults, but the children and the young adults, because now after COVID, our young people are having issues as well. And so you have parents who come work and they have to go home and they need those services, right? We also focus on substance abuse. We also focus on acute and management needs. That's case management, to also help with that. So that's some of the services we have provided around mental health that we have seen our employees ask for and they are utilizing.
No, I think that sounds good. Thank you, Lakeisha. And Lisa, same question for you.
Yeah, so we've always had, some mental health supports, and we just see that need increasing so much more. Obviously, we've always had a really robust EAP program for our employees. At the beginning of COVID, we luckily had plans in place to stand up a really robust critical incident stress management team. And in fact, are growing that team because we see the need for that increasing really every week. So we have individuals across our system that are trained in a CISM response. We're bringing on a new technology at the beginning of the year that not only provides just a variety of well-being offerings, because I lead the Well-Being Center of Excellence at the system. So we have not only just a wide variety of well-being offerings that dock into that mental health support, and Headspace being one important key component that we brought into this system several years ago and gave access for free to all of our employees as a key lever to help encourage our workforce to really start paying attention to their mental health and their emotional well-being. So definitely more important, and every year we add to the offerings.
No, thank you, Lisa, and we're pretty pleased to help both of you guys. I am curious, real quickly, kind of a dovetailing onto what you said, Lisa, about having that team of, I think, 8 employees on the critical incident support. Do you find, as we talk with a lot of health systems and other employers across the country and really the continent, a lot of times it is mixing that humanistic element of what you guys can provide and layering in like a Headspace or another solution that can really help to optimize. Would you agree with that and think that's quite valuable?
Yeah, absolutely. I mean, we see the tools such as Headspace and EAP as kind of the ongoing, like the preventative, right? We want to get ahead of those crises and help build and nurture resilience. So Headspace has been really a key part of those trainings and those opportunities for our workforce to really take time during the day, at work, at home, to learn some mindfulness, take a moment to breathe, help with a sleep cast to, get that meaningful rest. And then we have those in the moment, emergent type of situations where they need boots on the ground support. And that's really when our team gets called, and we can respond within 24 to 48 hours with several individuals to start leading those teams through processing the emotions from, whatever that incident may be. Maybe it was an employee suicide or an unexpected patient death or a really difficult pediatric case, regardless. So those two things really make complementary practice for the work that we do at St. Luke's.
Yeah, no, I appreciate that, Lisa. And Lisa, maybe let you continue on with this next question, but I know, having worked in a health system myself and working with a lot of health systems, it's a unique observation, but sometimes people who care for others can neglect, unfortunately, to take care of themselves because they're so focused on being that servant leader, that servant healthcare worker. But what really sparked the initial conversation at St. Luke's, and then we'll go to Lakeisha for JPS, around mental health benefits?
Yeah. So, I mean, it had always been on the radar. It's always been part of the conversation. But when we entered the pandemic with COVID, it really escalated quickly. And we saw a real serious need for that mental health support. I mean, it went from, maybe, a level 2 or 3 to 20 on a scale of 1 to 10. I mean, it spiked really, really quickly. And then in addition, Idaho is a very conservative state, and there was a lot of disagreement and a lot of political upheaval around COVID. How do we manage the pandemic? Who needs to get a vaccine? Like many other health systems across the United States, we were limiting access and limiting visitors. And so some of the community members in our hospital areas were protesting, calling our physicians and our healthcare workers and threatening them. I mean, it really got ugly really fast. So even just the political divide, even now, that continues. And so it has really created a situation within our workforce that coming to work is now not only about trying to do their very best to care for patients, but now it's about how do I keep myself physically and mentally safe, because the political environment has gotten so divisive. And it's an ongoing conversation. In just this month, our response to critical incident support, 62% of those were from incidents of workplace violence, of patients battering, abusing our staff. So that never used to be the case pre-COVID. So the escalation in that area has it's been shocking. And so our response has to be as equal to meet the need.
Yeah, no, that's it's painful to hear, but it's obviously important to hear, and to know that you can bolster support through mental health to help, take care of those who care for others. So Lakeisha, I'm curious around what sparked the initial conversation around mental health benefits at JPS.
Well,
similar trends?
Yeah, similar trends. I just want to, kind of piggyback on Lisa. It did start with COVID, of course. I think it was just such a shock for everyone to go through that, and just to kind of readjust, to get back into the workplace, kind of getting back into working in the different type of conditions. Our leaders really saw opportunity and really understood that they were seeing trends around, for instance, workplace violence as well. That's something that as wellness, we're part of the safety meetings, and then we can hear those reports. And it was beyond the patients and the employees, sometimes it's employee of employee. And so you think about, okay, what is going on in the mental space there, right? Is it something that is affecting their day-to-day? Is it something that they go home to deal with? And that's why our leaders wanted us to come along and bring something like Headspace, right, into our wellness strategies. We have had great opportunities to implement something for our doctors, our IT people, our, not our non-clinical staff, that they can utilize something as Headspace and then take those 1-minute type meditations before they go into new situations, or even take it home with them. So the behavior health, I think, is what our leaders start really focusing on, and really opening up that conversation around what can we do to help our people come back into this space where they have to help our patients, but they also have to take care of their mental health as well. So that was where our conversation started there.
No, I really appreciate that. And even before this webinar, sometimes we have to open up and take a 1-minute mindfulness break. So I certainly used Headspace to help do that, because it's always good to just be able to be in the moment and be able to care for yourself.
Yep,
so I think the last time we got together last week, both Lisa and Lakeisha, you both kind of mentioned that even foundation dollars or wellness dollars, maybe, like COVID was kind of an initial starting point to kind of double down into mental health. But I think both of your groups use some foundation and sort of creative funding to help make sure that you could provide expanded benefits. Is that kind of a general characteristic?
Yes. So we have wellness funds that we utilize from our provider, and that's how we are able to bring in certain vendors to help meet some areas we're focusing on, right? So if it's nutrition, if it's mental health, if it's chronic conditions, that's how we use our funds to make sure we're bringing in the right type of vendors. And for the mental health space, that's why we partner with Headspace. We have even went to a point where we've had you guys do webinars for us and around certain topics. We just had one recently. It was around change and anxiety, because we noticed a lot of people is going through change, and anxiety is something that we don't like to talk about, right? And we forget that our employees deal with that. They deal with that every single day. So we do use our wellness funds, and we try our best to make sure that we're bringing in the right vendors and we're bringing in the right strategy to help us meet those goals.
Perfect. No, I really appreciate that. So kind of level setting that COVID was an impetus to sort of redouble down into mental health care, always important for any organization, but especially your two organizations. Going into our next question, then kind of shifting gears away from, we've got the doubling down on the programs, we're enhancing mental health benefits. We want to make sure, to the board and to leadership that things are working. So what are some of the main ways that you're measuring the effectiveness of your organization's benefits? And I think, Lakeisha, I'll have you start this time, please.
Okay, sure. So right now we do look at analytical data, from Headspace. I have great reporting that we do look at. We're not quite there yet as far as measuring the data from the benefit side. Because like I mentioned last time we talked about, sometimes I do feel like it takes some time to implement a good program or a good vendor. It takes, I want to say, about that good 2 or 3 year, sometimes even 5-year mark, where you really can see people utilizing the product, right? Are they getting on? Are they using the apps? What are they using? What meditations are they using? What topics are they using? And you can really go back and see, from that data, okay, we have more people who may need more family, support, or maybe they're having more issues on communication with others. So right now we're just in that stage where we're just trying to get that data and look back. So it's right kind of in that moment where we don't have a lot of data to look at, but we're getting enough to go back and look, if that makes sense.
100%. And it's always going to evolve. So similarly, Lisa, what are you guys doing at St. Luke's to measure the effectiveness of benefit programs, mental health programs in general?
Yeah, so similar to what Lakeisha was saying, we do have some hard data and then some of the qualitative. So we look at EAP usage, how many employees are really leveraging that, how quickly are they able to get in, how many sessions are they using. So that's some of the hard data. I just happened to have a great meeting yesterday with Sarah, our Headspace representative, and she was able to provide some really nice, great data from the initial surveys and kind of a follow-up survey with our employees who use Headspace. And what we're seeing is those who are using the app regularly, they're reporting about anywhere from a 10 to 15% decrease in their stress levels. So that was really great. Some really nice hard data to come back to our leadership. We also have a really robust peer-to-peer support program that we've stood up across our health system. So many of us are trained in that peer-to-peer support. So we look at both how many we are getting trained and who's docking in, who's asking for that support. So, how are we leveraging the resources that we have? And then lastly, twice a year, we do something called Pulse polls that is sent out to every employee in our system. And it's kind of that high level culture questions asking, do you feel like you're supported at St. Luke's? Do you feel like you belong at St. Luke's? Some of those other things where belonging and appreciation are measured. And so we have benchmarks that we want to hit, and we review those twice a year. So if we're hitting those benchmarks, great. What are we doing? How can we improve? If we're a little bit below, really doing some deep dives with our leaders and our teams on where we're missing the mark and how can we improve and get that needle pointing in a better direction. So we come at it from lots of different angles.
Yeah, and I just want to piggyback really on Lisa too. We also do what we call engagement surveys. I guess it's similar, like what your hospital's doing. And it's really more of the getting what the culture base, kind of getting how people are feeling, are they feeling appreciative, are they not feeling appreciative, that it actually is going on right now, an engagement survey. So I think once we get data like that, it really helps the hospital know too what to bring into the system for their employees, right? And for help us as wellness with the right type of education programs, the right type of vendors to work with when we get data like that as well. So just want to piggyback and say we also do similar things just like Lisa Hospital.
No, that sounds good. And, I love analytics. I think data, you should collect as much data and use as much meaningful data in your pursuit of health and benefits programs. So really hearing the general themes of a mix of internal, I love the skew towards qualitative data. Quantitative data is great, claims, costs, all of that's there. All of that's always going to be there. But I think it's really about layering in the qualitative clearly, which both your organizations take a focus on, with the quantitative. I am curious, how do you kind of like organize that data or act on it? I mean, are you looking at like provider data maybe separately from support employee data, support workers? And then how are you really acting on that a little bit? Can you, either one of you, take that and maybe expand a little bit?
Yeah, absolutely. We do kind of tease out our provider data as opposed to the rest of our workforce data. And in fact, we just had we do what's called a mini Z, and it really assesses burnout and compassion fatigue in our provider population. And we just reviewed those findings on Monday of this week. Luckily, what we're seeing is our burnout rates starting to dip down a little bit with our providers. We don't do that directive of a survey with the rest of our workforce. So not our nurses, our other support services. But I lead the Employee Wellbeing Center of Excellence. I have a colleague who leads the Provider Center of Excellence, and he and I meet weekly and talk about where the needs are with our distinct populations. And then he and I lead a community of practice that just focuses on well-being. So we help set the high-level strategy for our entire system on how do we meet the well-being needs, both physical and emotional, for both the provider group and the employee group. Sometimes they're exactly the same. For instance, we have been doing a lot of trainings and education in all of our leadership development programs. So in each of our leadership development programs, we have a specific content that is focused on training our leaders how to lead with well-being, how to emphasize self-care, how to teach them to use head-based, how to dock into EAP, all things well-being. So we have a very distinct structure on how to bring those populations and then how to bubble that up to our executive leadership to set the strategy for our system.
Yeah, no, I think that's great.
Yeah.
And sorry, Lakeisha.
No, and at JPS, we work with occupational health. We do similar, a little bit to what Lisa do. We do look at we had a program where we work with physicians, because that was something that they reach out to wellness about on a daily about burnout. They were noticing physician was getting burnout. So we were trying to come up with strategies around that. One of the things was working with Headspace, working with our EAP team. We have an internal EAP team and we have an external EAP team. So what we did was bring in type of wellness webinars. We call them like a 30-minute quick type webinars for the physicians because they're so busy, but we focus it around mental health or burnout. We work with our spiritual care. We have a wonderful spiritual care department that we worked with to come up with different type of mindfulness strategies for our physicians as well. But we really focus a lot on the Headspace app, how to utilize it. A lot of physicians that gave us testimony that they really liked the app. They even said they used it with their family, their kids. So I think just having something as simple, sometimes we want to think too hard, right? Just making a strategy very simple, very easy for them to use, and just be able to get back and see that really helped. Did that really something you would use on a day-to-day? So working with occupational health do help us really reach out to those physicians, and now we're getting ready to work with our nurses. Actually, they reach out to us, so we're getting ready to put nurses in our strategy as well to make sure we focus on their mental health. So just want to add a little piece about how we focus on that.
I love it. And I love the clear, it's a good juxtaposition kind of as we transition to the next topic and around, you both mentioned burnout, you both mentioned, some of those things. So I know at Headspace, we have a tremendous data science team, and we continue to do a lot of extensive research on the benefits of mindfulness and mental health programs, including clinical health programs. We've seen about a 32% reduction in stress after 30 days of self-guided care within our app. 14% less burnout after just 4 sessions of guided content. And you guys both mentioned burnout. On the clinical side too, we can do coaching therapy, and our psychiatry meaningfully reduces depression and anxiety. I'm just curious, you might not have hard numbers at hand, but have you received feedback from your team after they've used one of your mental health benefits, and what does that sort of look like? How do they kind of bubble that up to you, maybe through those pulse surveys, or even seeing you in the hospital to say, kind of provide that member testimonial? I'm just curious. And Lakeisha, I might have you start with this one.
So we are still working on the data itself, right? We have a wonderful Headspace account manager to work with us as well. And we do see the data on our end where we constantly see people signing up to use Headspace. So we've had a good, I think 10 or 20% increase on that. And that comes through us marketing. We market on sliders and huddles. We have a wellness champion network that we love to death that help us always promote different type of programs or activities that we're having in the strategy. But we really focus on testimonials where people, and we've shared this with our leaders. We share like I said earlier, the leaders asked us to bring something in because they wanted something focused around, mental health and things like that. So we worked with our account manager to get those reports to them. And one of the things we report back is the increase of usage of the apps, and also through the personal testimonials. Mm-hmm. Sometimes we've had them through emails where somebody work in more of the business department and say, hey, he had issues with sleep, and something the app Headspace offered these sleeping type of little moments where it help him with his sleep issues. And he was so grateful for that because he tried everything. And here is something as simple as an app that he's used to help him improve his quality of sleep. We've had, like I said, again, the physicians have shared back with us. We've had IT people, and we all know our IT people are they're not very testimonial, but we've had emails where they say, hey, I really like this. They probably sit all the time. They're constantly getting a lot of calls, and they're not always happy calls, right? There's issues. So sometimes that felt overwhelming, and just having a Headspace app, one of the IT guys was like, I never thought that something like that could help me with my anxieties and when I work through the day, help me kind of work and finish my day without having all those type of feelings. So we really, from our end, I guess to answer your questions, went through testimonials, and we're constantly working with the data. But every time we get any good reports, we do provide that to leaders, and that's how they really like to see that data and how we can continue to have a relationship with Headspace.
Yeah, no, thank you, Lakeisha. same question, Lisa. Have you received any feedback? Kind of how does that bubble up on your mental health benefits?
Yeah, so very similar to what Lakeisha has shared. We always look at the hard data, and we look at usage, who's using it. One of the things I find interesting out of our employee population, RNs, our registered nurses, are the far and above the ones who use the Headspace app the most. It's our biggest employee population that use it, and they use the sleep cast the most, which makes sense. They're helping to get to sleep. One of the things I find interesting is, as I'm working with leaders, how often the leaders use a Headspace moment to start their meeting, or they integrate it into their huddles. They use it to, if a team member is having a real stressful day, encouraging them like, hey, don't forget we have Headspace. You can do, why don't you take 3 minutes and do some deep breathing and just go relax. So, just those little reminders that our team members are accessing it, and the number of emails that we get that says, hey, I had Headspace access, something happened, I need to get back in, those urgent emails like, oh my gosh, I've lost it. So we help problem solve it and get them back into the app. So lots of different ways to come around it, but it's always a combination of the quantitative and qualitative.
I love it. And I think that the focus on member testimonials is huge because, again, your workers are probably quite similar. I mean, there's a lot of differences. There's a lot of diversity out there, as there should be, but people who can really see something that's benefiting them and people like them at JPS or like them at St. Luke's, I think that's very, very powerful. So, sometimes with data, there's certainly different indicators. There's some, leading indicators that might not be as prevalent. But I'm just curious, there are less obvious indicators that employee mental health may be suffering. This can include lower presenteeism, higher absenteeism, as well as just lower engagement at work. And is this something that you've seen in your employer populations, and how do you address it? And are there any larger impacts from poor mental health that you've seen at St. Luke's, at JPS? And I think I'll start with Lisa for this one, talking about sort of those, less obvious indicators.
Right. So, like you said, they're a little bit harder to track. And as I pointed out, we do have a little bit harder data for our providers for sure. A little bit softer data and softer information just on our regular workforce. But we know we do support check-ins and rounding. So we know that the higher the mental health load is, we've seen more individuals just needing to take leave of absence. Yeah. I think you can make a really good argument with when during COVID and when we see high levels of extremely stressful situations, there is often a correlation of a higher incidence of maybe needle sticks or more patient safety incidences, stress level, we're not as mindful, we're not being as present. We can also see the correlation with our pulse polls when we're doing that engagement. When we were in the thick of COVID, our pulse polls of feeling like, yeah, I really enjoy my work at St. Luke's, it took a nosedive because of the mental stress and the physical stress. So it just points to, we know overwhelmingly that the importance of keeping our workforce mentally engaged and supporting them as much emotionally and mentally and physically, creating a psychologically safe environment, a physically safe environment is key to not only keeping themselves safe as employees, but it really trickles down to that excellent patient care. If I'm stressed out, worried, and not being mindful in the actions that I'm taking right here, right now, I know that my patient care is going to suffer. So our leaders at the very top, our CEO, all of our vice presidents, our C-suite, have highlighted employee health and well-being as one of the top 4 strategic initiatives for our health system. So it's a daily conversation, let's say, John.
As it should be. Daily conversations lead to meaningful change.
Exactly.
If you put something and you forget it, it's probably not going to be as meaningfully changed. Interesting insights there, Lisa. Same question, Lakeisha, about less obvious leading indicators, maybe other things that you've seen larger impacts. I think the tie into patient safety, that was certainly paramount. And that's something certainly that any health system or even non-health system wants to make sure, that safety is top of mind.
Yeah, I think for JPS, we really look at that larger impact with when people go on FMLA, their short-term disability, workman comps, we being in HR and having that opportunity to be close to that type of data. Let us know when people are stressed. Do they take those FMLA short-term disabilities? Are they coming back from those disabilities? And when they come back, have they went and got the help that they needed, or whatever the situation was? Or they're not being able to return back to work. Most of our leaders do look at that information. They want to know, what are people and how are people being productive? And again, it takes time to get that data, of course, right? But we can certainly look at data like that when you're looking at your short-term disabilities, and people are going in and when people are returning back. That's how we really focus on, I guess, that question for you. But other than that, I think our leaders have, just like Lisa, leaders have just noticed that we just need to focus on something around good mental health services for the employees, but I keep going back also for their families, because we forget that, you check into one job, right? And then you check out your job and clock in, but then you got a whole nother job on the family end, right? That's a whole nother.
And you might like that job a little bit better.
Yeah,
Some days.
but you never know. I mean, it can, if you don't have a family, maybe we have people who are caregivers, and they have to take care of family members, or maybe they're fur babies or something that they really, have to take care of. But whatever the case may be, if it's something emotional and it's something that they have to come back to work and they're dealing on the front end at home, and if it's very mental, it affects how they come to work and be productive, right? So that's why leaders want to have these services there, and they look at that short-term disability data sometimes and see if it work, like you say, the violence, the workplace violence comes in at, why are people so tense? Why are people so angry at each other? That's employee. We know sometimes patients will come in with that. But if you have employee workplace violence, then there's definitely some issues there. And a lot of employees and a lot of leaders want to make sure that they're addressing that.
Yeah. No, thank you, Lakeisha. Thank you, Lisa. I love the tie into safety. I was actually about 2 weeks ago on site with not a healthcare system, but a manufacturing client with Headspace. And, you don't always think about the parallels, but there's actually quite a few parallels. Deskless, hard to communicate, and safety. Potential safety issues are huge on plant floors, dealing with heavy equipment, dealing on production lines. So we're seeing that same theme of safety tie in across other industries. And I just wanted to bring that up because I'm sure there's, there's a diversity of industries represented probably on our audience today.
Yeah, we have one of our employee safety managers is from a very blue collar organization, and the work that she did there translated beautifully into the healthcare system, because at the end of the day, you can't tease out well-being and safety. They're very much integrated. So
yeah, no, and we actually found this was one thing, and it was highlighted 2 weeks ago at my visit there, but we know through some data that we do at Headspace, the average number of Headspace usage even increases the average number, on average, 3 more healthy mental health days through usage of Headspace. So that's something that, manufacturers or health systems or any organization, whether you're a bank or you're tech, you want to have people be more present, less absent in the moment. And that's something certainly that we're happy about. And it sounds like organizations like yours are tracking to as well. So I think we might get this one. I think we're tracking well to time. We definitely do want to get to some other questions, but I think one of these questions that's sort of in vogue is, what benefits do you think are most important to attracting the best talent and making sure they're well supported? And Lakeisha, I might throw to you first for that one.
Okay, I'm sorry. I was replying to somebody in chat.
No worries. What benefits do you think are the most important for attracting the best talent and making sure they're well supported? Because that's obviously become a little more challenging since COVID, I think.
Exactly. I was just talking to my human total rewards director about that question, because, in wellness, we don't always get a chance to really get on the end where the talent side and how they're recruiting. And from her perspective, to promote really unique benefits, like your wellness benefits, well-being benefits, because we have those millenniums and those Gen Zs, is that what they're calling them these days? And they are looking for flexibility, to be honest. So when we're talking about leaders, they're looking at what type of lifestyle benefits that they can bring in. A lot of our younger generation, they're looking for that work-life balance. And I think that is what attracts them when you're getting ready to bring in, the different talents into your organization. And I just know younger generations, they look for, do they have a wellness offering? Do they offer, things like Headspace for me? Is there a place for me to go when I feel anxiety and change, and so I think from her perspective, that's how they are looking at when they're doing their benefits and they're doing their offerings. We have something simple as pet insurance now, because people love their pets, and that's something that's emotional, right? And you want to provide those type of offerings. So they're looking at the younger generation, at lifestyle benefits, something that can fit the organization when they're looking for the best talent. So I hope that kind of answered the question a little bit, because that's from her perspective of what they're looking at.
No, that was great. And then Lisa, same question, attracting the best talent, making sure they're well supported across the state of Idaho for your service area.
Yeah, very similar to what Lakeisha shared. We have a younger workforce entering our system. So how do we meet the needs and the expectations of that group? They high tech, high touch, flexible work schedule. They have I think a more focus on family and the importance of family. So I know for St. Luke's, our benefits team is taking a hard look at parental leave, making sure that we have really solid parental leave. 76% of our workforce are women in childbearing age. So we went through a huge rehaul of our lactation spaces. And now we're looking at, parental leave and the well-being. Just how do we create a culture and maintain a culture where when you're at work, you not only are productive, but you find joy in the work that you do. And I think COVID took that away from us, quite frankly. I mean, I think it sucked a lot of the joy. So as part of our team, we're really focusing on how do we bring joy back? There's a lot of hard stuff going on, but how do we, as a team and as a healthcare system, how do we bring that feeling of belonging, that we know it's really hard to separate work from family and family from work. So how do we offer that opportunity for our workforce to create that harmony? And I don't believe in balance. I don't think that the balance is possible some days, but how do we create harmony? And I know that that's always the work. How do we support mental and physical well-being? And that's actually the last couple of team members that I hired into our team was what do you offer? Like, what does St. Luke's offer where I can ensure that myself and my family are going to be well provided if we need help through insurance or EAP? So
yeah, I truly think the word flexibility. I mean, that's what we hear. They want a very flexible workplace, maybe not those numbers, the balance, because balance is hard sometimes, but is it flexible? And do you have the offerings for us to take care of ourselves when we're feeling overwhelmed? And that's the younger generation sometimes. I have a young teenager, he's 19 and he is starting college. And one thing I notice about him is if things just get overwhelming to him, he gets a little stressed out. And so sometimes I even offer him using the Headspace to calm down with the mental, take a breath, And again, we have to think about employees. They can feel the exact same way. And we have to bring those type of services to them to help them just take a moment, and it's challenging because you want them to engage, but you have to show it that it's easy. It's easy as far as just clicking, putting the app on and just going with it. So I think that's one reason as well.
No, perfect. I appreciate that. So I think before we get into a couple audience questions, just wanted to tie this up nice and with, obviously you've invested your time, you've invested resources in expanding mental health benefits across your respective employer, systems. What's some of the most, I think I'll throw it to you, Lisa, first. What are some of the most promising results that you've seen since expanding mental health support for your employees?
I think one of the big wins was just seeing that survey from our providers come back this week and seeing that, yes, our providers are indicating that they're feeling a little bit better. They're seeing some of the things that have been implemented in easing some of the burden that they're feeling emotionally and mentally. We've seen our pulse polls start to come back up where people feel supported, they feel belonging. We have more and more leaders across our health system reaching out to our team saying, hey, we've heard about you using Headspace in meetings. Can you come in and train us how to do that? Or we know that there's some other programming that peer-to-peer support. What is that? How can we leverage it? So that reaching out and being asked to participate, I always say this, well-being used to be a nice to have. And after COVID, it is a must have now. It has really bubbled our team. And Lakeisha, I don't know if that you feel that same way too, but I feel like, our team for years and years was kind of this nice thing to do, but now it's like teams and leaders want us at the table. We are part of that strategic conversation and have much more leverage in making some of those key decisions because the programs, tools, and resources we have in place, the employees are saying it's making a difference in my day-to-day life through pulse polls, through conversations with their leaders. So
that's great.
And then the question, but
no, Lisa, that was great. And Lakeisha, same, maybe like one or two really promising results that you've seen with your mental health benefits.
I agree with Lisa. I think sometimes, and I directed this to because I took a time out to talk to my director as well over benefits because I wanted to really understand what results, because she's with the leaders, she's in the C-suite. What have we done on the wellness end that you're hearing back that we are doing well? And one of the things was through the testimonials. I think that's a win for us. Again, when people stop you or send you emails, it's working because we have 7,200 something employees and you're not going to hear from everyone. But when you get physicians and leaders and people from different departments sharing with you that this benefit is really worth it. Thank you for bringing it in to our organization. I think that's a win for us. Also through almost like Lisa, we've had other departments reach out to us and, hey, we would love to know more about the mental health type of services you're offering. We partner with our EAP team all the time. Any type of on-site events we have, we partner with the EAP team, but we also are promoting our Headspace as well. So we're trying to make sure we're combining both things together, right? If you can't get to an EAP service, here is Headspace here to hold you off a little bit until you can get to a person you can physically speak to, right? And sometimes the Headspace may help them right in the moment and they might not even need to move forward because the Headspace may have something for them, right? Maybe it was just me not taking a moment to take a breath. Or maybe it was me not utilizing my sleep properly. And that's in the Headspace trained me to do that. So those are just, there's many, many more, but I just want to highlight through testimonials, partnering with the different departments, and really working with my director and really having to sit down and say, share with me what my leaders are saying. Are you hearing these good things? Do we need to move the needle? Do we need to take the needle back? And so far, so good. We're able to renew with Headspace. They want to keep it. They want more of it. So to me, I've been doing this for over 25 plus years.
Wonderful years.
But anytime leaders say they want to keep something, right? That is a good thing. We don't like to hear cuts. We don't like to hear take it away.
Yeah.
So I think what we're doing at JPS is going in the right direction. It's continue to grow. But I think what we're doing right now is really working.
No, I appreciate that. And we've had some great questions come in from our audience participants. So one of the first ones, maybe I'll throw this to you, Lakeisha, first, but you, Lisa, as well. How do you encourage some of my Headspace friends? My Headspacers have been helping me to get this from the back end, so really appreciate them on the call today. How do you encourage your employees to utilize their mental health benefits, like a Headspace or like your internal EAP? Is it highly utilized? And how do you notify them about new resources and apps?
Yeah. And you know what? I didn't even mention this. Shame on me. We won the Mindfulness Headspace Award. I didn't even mention that. Oh my God. Sorry, you guys. We were so excited. That's our first year bringing Headspace on, but we promoted Headspace. The reason we got this is because how we promoted it. And I think this is the question. We really, first of all, work with the leaders. We wanted to make sure that we got a big announcement out about it. And so we had one of our leaders announce that we're bringing Headspace in. We have a wellness page that we have on the intranet. And we made Headspace their own little spot. So when people go, they see big old Headspace in orange that they can click to and download, right? There's no way to miss it, okay? We also do our wellness champions. We work through our Wellness Champion Network. We have Wellness Champion emails, and they are the best thing we've ever had, and they help promote as well. Those champions consist of managers, directors, they consist of leaders. So sometimes if they know what's going on, that helps them be able to know, okay, wow, the wellness team is doing this. This is what they have to offer. We do sliders, huddles. We're out and about in the organization. We visit our clinics. So we're doing all these things in our strategies to make sure that we have a good communication strategy. We have postcards that we work with our Headspace manager on. We have the postcards. I think we even did mailers one time that we pushed out. So you really have to put a good communication strategy plan in place for any new vendor that you have, and one that you know your leaders really want. I'm coming from that wellness strategy queen, where if you implement the strategies and you really stay on the timeline and implement them, you will see movement and you will see engagement.
Undoubtedly.
Can you
and
tell
Lisa,
I'm excited about that?
I can tell you're
Love
excited about benefits and well-being, and that's what you should be, because they are fun. And so, Lisa, I just wanted to add into that. I would definitely want to hear your comment, but I know there was another question. I want to tie it into this. I know you kind of commented on the chat, but I think tying it into ERGs, there's a question about offering, do either of your organizations offer mental health related ERGs, employee resource groups, excuse me.
Yeah.
And I know you answered that is something you do at St. Luke's. So maybe that's a way to kind of spin that and answer two questions a little bit for our audience.
Yeah. So what Lakeisha said, yes, we do all that. And I'm just going to take a step back further a little bit, because I think almost the first step for us was we had to destigmatize mental health, right? We really wanted to push out that everybody has mental and emotional needs. And so making it okay to ask for support and help was really kind of that first step. And then docking into the strategy, similar to what Lakeisha was saying, all of the ways through our well-being champions, the internal, they get information on the first day of employment through their new employee orientation. So all of these ways. The ERGs, the employee resource groups, we're working with Derek Nelson. He's our director of DEI at St. Luke's, and we'll be standing up those ERGs in 2024. So again, just another great way to disseminate information and keep our workforce informed of all of the resources that are available at their fingertips. We have a really strong, I'm sure you do, Lakeisha, too, we have a really strong relationship with our marketing and communications team. And so every week we provide them content, little mini stories that bubble up on the front page of our intranet. It's like well-being happening every week. So they can dock in every week. There's a new reminder or tickler about one of the well-being resources that our workforce can dock into. So
I like that, a tickler. That's
tickler.
I like that tangible way of doing that.
Yeah.
So I think we'll be able to take one final question before we take final comments and kind of tie us up for the hour. But there was a question that came in around, with this crisis, meaning COVID and mental health, the impact of mental health. Aside from mental health benefits, have you looked into other alternatives other HR related alternatives to retain workers. So going back to that talent recruitment, talent maintenance, kind of keeping folks out. I'm just curious of thoughts or comments around that. Either of you would like to step in?
Yeah, I don't know if I can answer that effectively, because again, in wellness, we don't really work with our recruiters so close. At some time, that's something that I would like to close the gap on, to be honest with everybody. And I think wellness, at some point, we get into new hires orientation, right? But we don't necessarily get out there when they're out there recruiting and they're out there, trying to find new talent. We have given some swag away, around wellness here and there. I've given postcards about Headspace to some of the recruiters. I've given, and other programs that we have in place. And that to me is the only thing I have done. Now, how my recruiters use it when they go out to those talent type of events, I'm sure they put it on the table. I'm sure they talk about it, but that's something that we have talked about in meetings to start being more connected with our talent group. So I love that question, because that is a gap that we have that we really don't do. We only get them when they join the organization. We're not getting them before they join our organization. So I want to say thank you for bringing that up, because now I have something to work on, because I'm already kind of working on it, but it is truly still a gap for us on the wellness side.
Yeah, no, I appreciate that. And that's what I think we do. We build on each other and we learn from each other. So Lisa, any comments on that?
Yeah, kind of similar. We don't get in front of that work. And like you, Lakeisha, it is an area of opportunity for us. The first thing that immediately popped to mind when you voiced the question was, we have an entire massage team that we deploy on all of our campuses. And so that's kind of an interesting little perk that I do know our talent team talks about, is like we have table and chair massage on site that helps support those moments to provide some meaningful rest and relaxation at a very small amount of money, where our workforce can schedule a chair or table massage that not very many other organizations have, I think. So I know it's one little thing, one alternate that they pitch as one of the perks at St. Luke's.
Yeah, and I guess for us too, we have an incentive program that I think recruiters might talk about. They can earn up to $500 when they complete certain wellness activities. And that can go into their HSA funds, or you can go into their paycheck. I know recruiters like to talk about that a bit sometimes. On the wellness end of our incentive program, we call it our rail credit. And that helps because, again, you're the young generation, they like money. So I think sometimes they help a little bit.
They better be saving.
I know, right? But that's more on the benefits end as well. And I think they may promote it a little bit more of benefits versus wellness. So that's the gap we need to close, right? But that is something they probably utilize as well to help recruit. So I hope that helps a little bit.
No, I think that does. Thank you both so much. And I want to keep us on target for the hour close and make sure that mindful of our audience to get to other meetings or to get to take a few moments in their day. I did want to call out for both of you. We got a comment from an audience member and really appreciate this comment, that kudos to both you, Lisa and Lakeisha, for being proactive and taking employee mental health and wellness head on. In this person's experience, there's been a lot of check the box and feeling of just pushing this off to their health plan or not being an active participant. So having known these two, having worked with these two organizations with Headspace, these two are great organizations, and Lisa and Lakeisha are both great. So I just wanted to call that out for you, that your work is definitely being seen and felt, and I'm sure it's seen and felt in your organizations.
Yeah,
so
thank you,
guys.
With that, I just want to thank everyone today. Thank you for joining us today for this GoLIVE Health webinar in partnership with Headspace. I greatly appreciate both Lisa and Lakeisha for their time today, as well as the audience. We really appreciate the engaged audience and the comments from the audience. Sorry we weren't able to get to all the questions, but I think this was a great hour. Really appreciate your participation. And thank you and have an excellent day.
Thank you to our speakers and to everyone that joined us today. Please visit our website at community.hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, October 8th through 11th for Health 2023.